Welcome back. It is summertime, and that means some of you sun worshipers might have gotten a little too much exposure. Joining me now is Dr. Verrett. Thank you so much for coming on the show.
Well, thanks for having me.
And this is your specialty, fixing skin damage after it's occurred. I mean, it's a pretty serious issue that a lot of people face. What can we do?
Well, absolutely. There are several things, and in this situation, an ounce of prevention is worth a pound of cure. And basically, when we look at aging, we look at two types of aging. We look at intrinsic and extrinsic. Intrinsic being genetics, nothing you can do about it. Extrinsic, primarily from sun damage. As you had mentioned earlier, sunburns actually are a very bad thing. And they cause premature aging, both causing a decrease in collagen in the skin, an increase in elastin, which causes wrinkles, and also predisposes you to skin cancer, which is obviously a much bigger problem. The three most common types being basal cell, squamous cell, melanoma. Now, what can you do about it? Well, there are a lot of things. With skin cancers, obviously, you need to treat those and talk with your dermatologist, primary physician. But when you have aging that you just want to get rid of, talk to me. I'm a facial plastic surgeon over in Dallas, and there are a lot of different options that you can use, from over-the-counter creams, such as the vitamin A creams, chemical peels, laser resurfacing treatments, and then for people with a lot of wrinkles or a lot of photo damage, you can even undergo facelifts and similar procedures.
Now, which one do you think is kind of the best out of all these procedures, gives you the best results?
Excellent question. And there's not one procedure that's fit for every person. You have to tailor the treatment to the actual person and their skin, their age, their amount of photo damage. Bang for the buck, though, one treatment that probably gives you the best results are laser resurfacing treatments. And the ones that probably a little bit more invasive but a little bit better result, carbon dioxide laser resurfacing. And they've kind of come a long way. What you thought of as laser resurfacing that caused months of redness and problems with demarcation lines, or red, white, or white and darker borders, actually have gone away to newer technologies that don't have as much downtime, don't have as many complications, produce very nice results.
Now, and you wrote a very helpful book, the Patient's Guide to all these cosmetic procedures, especially facial ones. You provide great tips on how to do your homework and what to look for.
Right, and I think that's very key for patients to understand, is that when you undergo any of these procedures, you need to have some idea of what you want to undergo, but then go talk with a specialist who knows what options are out there and can tailor a treatment plan to each one of your patients. So when looking for a doctor, you want to make sure that they're board certified in what they're doing. Now, you could be board certified in internal medicine, but that doesn't mean that you're a good cosmetic surgeon. So you want to look for a facial plastic surgeon or a plastic surgeon if you're undergoing procedures, a dermatologist if you're undergoing skin treatments. You also want to look at what facility they do surgery at, because not all facilities are created equal. They don't have the same guidelines that they have to meet. Some of them aren't even accredited. You also want to make sure, something people don't think about and isn't in the media quite as much, make sure that your physician, if you're undergoing a larger treatment, has hospital privileges somewhere nearby, just in case one of these complications actually happens.
All right, well, Doctor, thank you so much for coming on this show. Where can we get a copy of this really quick?
Books available on our website, innovationsfps.com, barnesandnoble.com, or amazon.com.
All right, we'll also have a link to that on our website, connectamarillo.com. Thank you so much for coming.
Thanks for having me.
We appreciate it. The time is now 6:19. More Daybreak after this.